This is ChangeMakers with Katie Gore, finding the right solutions for the affordable housing community.
This week, we're going to discuss mental health and its impact on housing and homelessness with ChangeMaker Dr. Vincent Atchity. Vincent is the president and CEO of Mental Health Colorado, where he champions public health and health equity while working to disentangle mental health from criminal justice nationwide. Vincent, welcome to the podcast.
Why, thank you. Thanks for having me.
First, I'd like to start these by just having you describe how your journey has been in mental health advocacy and maybe talk about some approaches to mental health policy. If you want to start us off there, that'd be great.
Sure. It may be hard to follow across a complicated career trajectory, but landed in mental health advocacy, having started out focused on community health and social justice, and then through a series of different experiences in supporting the community health of specific populations, ended up getting zeroed in on the intersection of mental health and substance use as a key aspect of our experience as Coloradans that's often associated with poorer health outcomes than we might want, and arguably also much higher costs in wrong areas of spending than we might want if we were to do things deliberately as a community.
So tell me about maybe an overview. What's the current state of mental health and how you've seen maybe in the last 5 years, how it's changed just as an industry? So for some context for us.
Well, I think different aspects as an industry to think about. So to clarify, by industry, I can talk about the care provider world of the healthcare system and changes there. But then there's other aspects of our mental health as a state that I wouldn't necessarily associate all that closely with that particular industry.
Why don't you tell us about the care provider world?
Well, the care provider world, I mean, to put it very simply, it comes down to how folks are paying for the care that they're trying to access. And so that divides us as a community in a number of different ways. Some of us access care because we are eligible for Medicaid and enrolled in Medicaid, and that creates a certain pathway. Some of us have private pay insurance through our employers, and that creates a slightly different pathway. And then there's still some who fall between cracks there, and if they're accessing care at all, they're accessing it by spending out of pocket and not incurring the payment of an insurance entity, whether public or private. And so the consequence of that division is that we've got separate whole structures of care in the state, and members of the population are not necessarily fixed in their pathway of accessing care and can shift from one of those structures to another any number of times over the course of a life. But none of those structures is perfect in terms of being readily available to those who need it when they need it, and in a reliably high quality kind of way. And the consequences of that are felt across the lifespan by Coloradans in each one of those different categories of folks.
So as it relates to mental health and housing instability, what are you seeing that's happening in Colorado? Let's start there, and then maybe we can expand from that.
Yeah. With housing instability, one of the first things to point out is that if we are experiencing any quality of mental health today, we are too scarcely aware, or our fluency is too poor in sharing and understanding that the quality of our mental health today is very much dependent upon the stability of our housing. As soon as our housing is destabilized for whatever reason, regardless of how we started the day today in terms of the quality of our mental health is in jeopardy. And depending on the destabilizing factor, jeopardy can become a crisis in really short order. That's the way I like to look at the housing situation, is that we need to, those of us who have stable housing, or what we think of as stable housing, need to be reminded of the extent to which that is a factor in our experience of well-being. Because then when we turn to think or talk about the individuals who are not experiencing that stable housing, we may much more empathetically access the extent to which their mental health conditions are tied to, perpetuated by, exacerbated by, in a kind of chicken or egg kind of way, the fact that there is no stable housing as part of their essential picture.
And when we say stable housing, this could be a range or a spectrum of things, anything from lack of attaining housing or housing in very volatile areas to homelessness. So we're talking about a huge spectrum when we say unstable housing, aren't we?
That's right. That's right. That whole range of things. And, our needs for stable housing can vary from individual to individual, and they can shift because what is effectively sustainable for a single individual may not be effectively sustainable for that single individual if they're experiencing a disability or advancing in age and no longer quite as able to support their well-being autonomously, or if they're children in the picture, that can also complicate one's experience of stable housing.
And what are some of these challenges that people are facing when they're confronted with this, either finding or maintaining stable housing?
Well, if one loses one's housing, that is that kind of immediate crisis that I was referring to earlier, and it becomes this sort of all-absorbing focus of one's daily attention, to the exclusion of much else, so that people who have lost housing are kind of returning to the state of nature where the priorities are food and water and shelter and places to relieve themselves. And when one's whole day is driven by meeting those essential needs, the ability to do other kinds of things that those who experience stable housing may take for granted, that ability becomes extremely elusive and highly challenged by meeting the basic needs.
And I read about a program that you offer that provides individuals with safe shelter as the first step in helping the most vulnerable. Can you tell us more about that?
Yeah, thank you so much. So our SAFER initiative, this is an initiative in Arapahoe County that serves some of the neighboring counties, but the primary population served are individuals who have mental health or substance use related needs, often co-occurring, are experiencing homelessness, and also have some justice involvement. That is, that they have been diverted towards the SAFER program by local partners as an alternative to what might happen to them instead, which is living under a bridge or being in Arapahoe County Jail. And so what the SAFER program does is it provides that essential first step of having something stable in terms of a place to lay oneself down at the end of every day. But beyond just that safe, secure space to call one's own, the SAFER program manages and coordinates access to the other essential resources that individuals experiencing this set of conditions really need to have reliable access to if we are to have any reasonable expectation of them finding longer-term stable housing and employment and reintegrating and remaining successfully integrated with their communities. And they need a bunch of things. They need access to health care. They need access to mental health care. They need access to the documentation that they may have lost along the way that enables them to access all the other systems. They need access to employment opportunities and ongoing support of peers and groups that understand the effort that they're making to succeed in community. So it sort of cobbles a village of effort together by coordinating personalized access to supports and services for individuals.
Give us a sense of the kind of volume you're seeing of people who are participating in that particular initiative.
Well, SAFER is a small program, and we launched this work in the early days of the pandemic. And over the span of the last few years, have served over 100 individuals. But the need out there vastly exceeds what we have been able to serve.
And then do you have studies of what the need is for Colorado specific or for that particular county?
There are some studies out there with regard to point-in-time surveys of homeless populations statewide. And there are efforts going on statewide to build more of what's called permanent supportive housing. And some 1,000 or so units have been established across the state in the past several years, but it's generally considered to be a drop in the bucket in terms of what the need actually is. I think that we need to get to a place where every single community in the state and nation understands that there's always going to be a population of individuals who are not going to be able to successfully integrate themselves into a community where the cost of housing is high, with employment that affords that, due to their unmet health conditions, without a team there to assist them and help meet some of the needs.
You mentioned a minute ago 2 things I want to follow up on here. You talked about substance and you talked about justice. Let's break those up because each of those are quite a lot given the needs of the people that we're talking about and that you're serving and how that relates to housing. Let's start with the substance. And I view these podcasts and these conversations as a lot of awareness. So there can be some verbiage and some faux pas here as we have this conversation, but help us out in knowing how to understand some of these dynamics.
Yeah, great question. And there's a lot here to unpack, as you suggest. And I think it begins with a history of discrimination around substances and substance use. And part of that discrimination manifests in that structural segregation of mental health from substance use. That is a segregation of thinking about humans that is reflected in the systems of care for both of those things, but is a fallacy with regard to the nature of humans, because to segregate mental health from substance use is an error in understanding human nature and the nature of what humans are doing when they're using substances. And a lot of it is associated with their mental health. That's what people are doing. And then the other discriminatory aspect of it that I like to point out to crowds of folks who may be stuck in a cultural pattern of discrimination without even knowing it is point out that the elephant in the room is always alcohol. When we talk about the substances, and there's many of them that are deadly and get a lot of attention in the media. And right now, as you know, we're in the midst of an opioid crisis. Fentanyl is everywhere and deadly. But when you look at a chart of all of the various substances that humans use and their relative harm to self or others, alcohol is off the charts in terms of its harm to self and others. And yet, and it's a great place to begin the conversation about discrimination, is because we have not learned to successfully live with alcohol. And yet, we undeniably have it interwoven into our whole cultural milieu in a way that is inextricable and yet perpetually harmful. And I think it's an important place to look to have a conversation about discrimination, because it's kind of where discrimination begins and we move away from it quickly and have a habit of wanting to discriminate against people based on their choice of substances that they're using. We forgive some things, we damn others. And it creates a system of sort of class and privilege of access. If I am able to access prescribing care providers from an early age, and I'm able to access a pharmacopoeia of substances that are legal for me to use in association with my mental health, as long as I'm using them in alignment with the way they are prescribed. If I am unable to access that network of providers, then there is not a pharmacopoeia of legal substances, but there is a pharmacopoeia of illegal substances that is bountiful across the landscape. And one way or another, humans use their substances. They use them. We do, and have since the dawn of time. I think that maybe we evolved to be bipedal and upright in order to reach things that could be plucked and fermented or something like that, or at least ingested for stimulant purposes, because caffeine is another one that is a gigantic industry, and people don't bat an eye with regard to people's remarks about their addiction to caffeine. So we've got all kinds of sloppy thinking when it comes to being consistent about substances, and then it ties quickly into poverty and race and class and the history of who uses which kinds of substances and how we're going to react to them. So we've got law enforcement around some things in some neighborhoods, and less law enforcement around the same things in other neighborhoods, and uneven law enforcement when it comes to harms to self and others associated with certain substances.
And that's a good segue to our next topic, the criminal justice system. But we have to pause here. Coming up next time on ChangeMakers, Dr. Vincent Atchity, the president and CEO of Mental Health Colorado, will discuss tackling complex problems with a simple mindset.
It's complex, and yet I think it also comes back to the sort of simple message of caring and knowing that it's not enough to care for a community to only care for those that are perfectly capable of caring for themselves. A human community is measured in its humanity by the systematic dedication it brings to caring for the vulnerable.
Thanks for listening to ChangeMakers with Katie Gore. To find out more about Katie, go to quadel.com. That's QUADEL.com. This has been a production of Forbes Books Radio.